welcome to the Health Show. My name is Sal DeBella, and I'm your host. We're just starting a new series on holistic and alternative treatment doctors, the veterinarians. And today we have a holistic veterinarian. Her name is Cathy Alinovi, and she's a retired veterinarian. She's a celebrated author, a nationally renowned media personality, and a pet expert. And she's also a total animal lover. So welcome, Dr. Cathy.
Thank you.
Okay.
I'm glad to be here.
Thank you. I'm happy that you are the first person that is starting our show under a new category. And we have many more veterinarians that want to come forward and talk about their treatments. So can you give our audience a little background on yourself and what your credentials are?
You bet. I graduated from Purdue University School of Veterinary Medicine in 2001. And one of the things that I found out was I don't know how to take care of everything. So I'd get in a patient who was limping, and I knew it was the shoulder, and I had nothing to do to help this animal. So I was stuck, and the dog was limping, and there was nothing we could do. So then I learned chiropractic medicine, and I could help that animal. And then I learned acupuncture, and I learned herbal therapy, and I learned food therapy, and all these different things that helped me be able to present the pet owner and the pet with this huge set of options so that they could decide what was best for their situation, their animal, and how best to get the treatment that they needed. And so it's been a really interesting process over the last 15 years. And so now at the end of all of this, there are a lot of options to offer for animals. And the great thing is that there's more things out there every day, more things to learn, more possibilities, and it's really very exciting.
Mm-hmm. Okay. We have a lot of questions, so let's get right to them. Now, what type of animals do you treat?
Primarily dogs and cats, but the great thing about what I do with the whole integrative medicine really is that I can treat any species. When I graduated vet school, because I'm in rural Indiana, I had thought I'd be working on large animals, but the large animal business really fell to the wayside after 2008, after the economic recession. And dogs and cats were what continued to come in, and the dogs and the cat, their owners were searching for alternative treatments, which is how when I was in practice, I'm in the middle of nowhere in Indiana. I had people driving to me from 3 hours away. I did phone consultations, anything to get people options to help their animals.
Okay. Now, what are cancer rates so high in animals?
They're not only going up in humans, they're going up like crazy in dogs and cats. The statistics say that for dogs over 2 years of age, 50% of them will be faced with cancer. The cancer rate's not quite as high in cats, it's not as well characterized, but dogs, this is huge. And so 50% of adult dogs have cancer right now. 50% of pet owners are having to deal with this. And so the rates are really high. And think about all the things that we do to them. Because I'm out here in the country, my clients have said to me, well, when we had farm dogs when I was little, we didn't have to deal with all these things. It's because we weren't doing the things to them that caused the cancer. We vaccinate for a lot of things now. We treat for fleas. We prevent heartworms. We have a pill for anything. Think of all the chemicals that we're putting into these animals. How about pet food? Before the 50s, pet food didn't really exist. When you were a kid, what'd you feed the animals? Table scraps, right?
Right. Mm-hmm.
It was healthy leftovers from the people food. Now there's commercially prepared food that in my mind is a lot like feeding a toaster pastry. Same thing, meal after meal, really processed, and that's adding inflammation to the body. And pets are little sentinels for all these things that gets compacted in this little body, and they express it a lot faster than we do as humans.
Now, at what age have you found that dogs and cats start to get cancer? Is it young? Is it middle age? Is it older?
It can be, it's all of those. The youngest dog I've seen with cancer was an 8-month-old St. Bernard puppy. He had bone cancer. We were able to keep comfort for him for 4 or 5 months, and then it just became huge, this big around his wrist, and he couldn't walk, and he was in agony, and he was at risk of it breaking. So, 1.5 years old, this puppy was euthanized because he had cancer.
Okay. So the next question is, what natural treatments are available for disease in dogs and cats?
So your health show, and you've talked about all those alternative options for humans. Most of those were studied in animals first. And so all of those options are available for animals. So SEACT can be used for cancer patients. I have a whole ton of patients that are on vitamin B12. We've got herbal therapies. How about homeopathy, ozone, acupuncture, fecal transplants. There's just this wide variety, and it depends on what's the syndrome going on with the animal. Many, many options.
Also vitamin C.
Absolutely.
And
Absolutely.
intravenous vitamin C and all of that. So
Yes.
whatever shows we did before, and whatever doctors came on and said this is the treatment that's out there, and this is what they're using, and they're having success with, you had the same success.
I have, because I am a small clinic. I didn't have the number of cases that some of these specialist centers, but an example is I had a patient, it was a 12-year-old Springer Spaniel who was in congestive heart failure. His conventional veterinarian did what all their usual things, but his owner was really well researched, and so came to me because I was able to offer ozone therapy and ultraviolet treatment of this dog's blood. So I take a small sample of blood, treat it with ultraviolet light, and add in some ozone. I added in vitamin C and also some B vitamins, injected it back in, and we got that dog some excellent quality for a year and a half. It was fantastic. Much longer than the cardiologist expected. It was a wonderful thing.
Mm-hmm. Okay. Now, what type of second opinions are there available for pet owners?
Oh my goodness. The second opinions are such a huge thing, because pet owners, they go into their veterinarian, and if they go to a conventional veterinarian, they only know one answer. And for some pet owners, they're used to thinking for themselves for alternative options. So nowadays, because the internet is such a great thing, we can do phone consultations, internet consultations. People who live in big cities like you do, there are many alternative veterinarians, so you can go and get another set of eyes to look at what's going on, so that the pet owner can then pick the best option for them and for their pet.
Right. And I would imagine holistic medicine is much cheaper than chemotherapy and radiation, right?
Yes and no. because I have had people come in and expect it to be free.
Oh, okay.
Which is silly. But if you think on the scale of traditional conventional chemotherapy, you're looking at $5,000 to $8,000 treatment for like a lymphoma or lymphosarcoma case. In alternative therapy, what would we suggest? It might be an ozone treatment. It might be the UV treated blood, which, that can be $150 to $300. Herbal therapy can be anywhere from $30 to $100 a month. So it can also add up. And the thing that people don't realize is that veterinarians who get holistic training basically are specialists. There just isn't a American Veterinary Medical Association board certified specialists in some kind of holistic medicine. So there is a lot more expense on our end to get there. So sometimes it's less expensive, because what if it's as easy as I treat that cancer case with diet? Then that's an office exam. But if we need to do intravenous therapy and all those sort of things, then yes, it can start to be costly.
Okay. And how do you treat epilepsy?
Food. Patient comes in, dog or the cat, usually dogs, is having some kind of a seizure episode. We do basic blood work to see what's going on, make sure there's no infection, no liver disease, that sort of thing. Then the first thing that I recommend for these animals is get them on high quality food. What's the biggest thing we do for our animals? We give them food and we give them water. So if the food and the water have things in them that can cause inflammation, then that's what happens in the brain, is that we have seizures. The things that cause inflammation are byproducts. They can be grains. Corn is a very guilty culprit in pet food. How about food dyes? My daughter has crazy reactions if she has red food dye. Like, I have about 3 hours of her just being off the wall crazy, but it does that to our animals. And the thing that people don't really think about is that all of the chemicals in the intestines that make the intestines work are the exact same chemicals that are in the brain. So a lot of seizures can be treated through the gut to make the brain stop being overactive. So that's the very first thing that when I was in active practice that we would do. We address food, and when people call me now for a phone consultation, we talk about food. That takes care of 80 to 90% of the problems. It's great. It's easy.
Right. Well, in my opinion, most animals, owners, go to the faucet and get water and put it in a bucket or put it, in a bowl and put it down, and the dog or cat is drinking water that has, like I know here in Massachusetts, they say there's 69 chemicals in the water. And there was a new on TV, must have been about 2 weeks ago. There was something new that was cancer forming that they just found in all the water in about 50 states, including Massachusetts. So I think, a lot of humans nowadays are drinking bottled water compared to animals. I guess I don't think many owners, there might be some, that put the bottled water or better water in the bowl for a cat or a dog to drink. So I think drinking the chemicals every day, like this cocktail of all of these chemicals every day, I don't think it's not only good for humans, but it's not good, I don't believe, for animals also.
I think you're absolutely right. And what we don't know about those 69 chemicals, how does it interact with the chemicals in the pet food? How about in the tablets that we give them to prevent for fleas, for heartworms? We don't know. We don't know. There's no scientific study. It's being done in the study of life with these poor animals. They're a science experiment. You're absolutely right.
Now, how do you treat kidney disease, liver disease, and heart disease?
These all go back to food for me. What I find, I spoke a minute ago about inflammation, but I didn't really describe it. So think about when you have a headache. You have inflammation up in your brain. There's swelling somewhere, it puts pressure, it hurts. That's in your brain. But inflammation can happen in the whole body, and how we see it in our pets is maybe through shedding. They can have dull hair coat, droopy eyes, just not have the perk that they had when they were puppies. And so any cause of inflammation can turn into a cause of maybe kidney disease or liver disease, heart disease, skin disease, huge problem. How about chronic bladder infections like a lot of cats get? And so it gets expressed in the body in different ways. And so I always want to go back to the fundamental thing that we do to these animals. And so it's feed them and give them water. And if we can give them the very best input, then it makes whatever's coming out at the other end be that much better. So if we put in high quality ingredients, real food, real meats, real vegetables, then we're reducing the inflammation in the body, so the body can heal a lot, and then we only have 20% of the problem left to treat holistically, or however people want to, with herbs or with medications, whatever is appropriate for that disease. So heart patients. I had this little miniature pincher come in a couple of years ago, and he came in for his wellness check, and his parents were like, well, he's old, so he's been going blind. And I look at this little man, and his eyes are bugged out, and they're all red, and his eyelids are shut, and he's got big tears coming out and stuff. Well, it turned out that he had high blood pressure that had gone on so long that he actually ruptured one of his eyeballs. But he was a little feisty because he was a min pin, so they weren't touching him because he would have bitten them. And what it basically came back to, the way I got the blood pressure under control, no medication. I took him off of his dog food that was full of salt, and we put him on real food that had no salt in it. And like you said, they started giving him bottled water instead of city water. Mm-hmm. Crazy.
Right.
It's that easy in some cases.
Now, I just did a show with a naturopathic doctor that talked about inflammation. And she thought it was so important to get that inflammation out of your body. Unfortunately, with me, there's other doctors that I spoke to about a problem that I have. And the problem I have is lower back pain. And I think there are millions and millions of people. Now, I found out, believe it or not, I don't like to put chemical in my body also. That's one thing I learned a long time ago. And, but the pain was so bad, and everybody, I had pressure from everybody to go get an epidural. And I had a bad time with this epidural. Firstly, it didn't work. That's the first thing. Secondly, they put it in the wrong place. It didn't go where it should have went. But in talking to other doctors that I've interviewed before, one of the doctors, Dr. Flavin, she told me about these over-the-counter drugs that you can get. They're not really drugs, they're natural. And if you want to go to my website and go to the contact page, thehealthshowboston.com, and contact me, I will show you what I take. And it's amazing what I take, I have no pain. Where my foot was numb somewhat, it's not that numb anymore from sciatic pain. And the pain is not there as long as you keep taking these supplements that I was told to use. And one of them is turmeric. I've been taking turmeric for a number of years. Even before, I found out about these other supplements. So now I take like maybe 6 or 7 supplements for inflammation, and tremendous, big difference in my pain.
Wonderful.
So again, if anybody wants to find out exactly what I take, thehealthshowboston.com, go to the contact page, contact me, and I'll send you exactly what I take. So let's go to another question. You talked about vaccines before. Now, I stopped taking vaccines many years ago. If you look to see what's in vaccines, it's really amazing. So can we talk a little bit about vaccines?
You bet. And I bet you when you looked at those vaccines, you had a really hard time finding the exact ingredients in them, because they're proprietary information, which makes it really hard for anybody to know. And so reactions are really common in dogs and cats. They'll get like a swelling. Some of them will actually go into anaphylaxis where they won't be able to breathe, but usually it's a swelling at the site where the vaccine was. And the pet owner wants to know why. Was it maybe the rabies, the killed rabies virus? Was it this adjuvant thing that's a stimulant of the immune system? There are antibiotics in there. There are dyes. There are all sorts of secrets, and so we don't know what it is. And so any of these things can cause reactions. And that's only one part of the problem with vaccines. And see, you're like me, it's like, okay, vaccines are out of my life. I do think that there's a place in very young animals when they're about 4 months old. It'd be nice for a dog to never have to get infected with parvovirus. And so, you vaccinate that dog. Well, the studies are actually showing that these animals are protected for the rest of their lives from one vaccine given at 17 weeks old, either to distemper, parvo, or rabies. But the problem is there's the law. The law says that we have to booster the rabies, and there's also the vaccine companies. And honestly, veterinarians make a lot of good money on vaccines, and so who wants to stop vaccinating? Everybody wants to give the vaccines until you think about what are we doing. And I went through that. So when I graduated vet school, I went and worked for a couple of different veterinarians. And when I graduated in 2001, the information about longer duration of immunity was starting to be discussed. There were 3-year vaccines available on the market. And so I asked my first 2 bosses, I said, hey, how about those 3-year rabies vaccines? And they both said the same thing. They both said that they want to give the 1-year vaccines because they want the animals to come in every year because they want to give their health checkup. So I thought about that for a while. And then when I started my own practice, I finally decided that the only reason people are coming to me is for vaccines. I don't want to be their veterinarian. I want to be the one that they come to because they want healthy pets. That's where I got my name when I finally came up with my business name, with Healthy Possibilities. It's long-term healthy pet care. How am I going to give your pet healthy care if I'm insisting on a rabies vaccine every year, distemper combination vaccine every year, Lyme vaccine, lepto, we can do canine flu, how about kennel cough? Then there's some vaccine for tumors in the mouth. Oh my goodness, it's crazy, isn't it?
Yeah.
But it was the money. You got to think about the money trail, and it's very lucrative to give vaccines. And I finally walked away from that, I made the local law when I was in practice, made sure that people understood the local law, and everything was in their hands from there. But vaccines, they supposedly protect the immune system. I think they challenge the immune system and make it overact, and animals can have reactions 30 days after getting a vaccine. It's crazy. And so then how do you do a vaccine and 30 days later something happens, and how do you know it wasn't from the vaccine? And these animals, they don't deserve that. We're trying to protect them.
Right. We were talking before about seizures. Just dawned on me. I seen a video on the internet, and I spoke to a few people, doctors, that gave medical marijuana to children that had seizures, and grown-ups also. And it's amazing where the child would have 20, 30 seizures a day after using the marijuana, the medical marijuana. They would have maybe 1 or 2 seizures a week, and then it got better and better and better. There's a veterinarian that's going to be coming on pretty soon talking about medical marijuana that he uses quite a bit, not only for seizures, but for cancer. Like they use today with people for pain, and they use it even to get rid of the cancer, hemp oil, So he's going to be talking about that. So I use maybe 20, 25 vitamins a day. So what do you suggest to stay healthy? What do you suggest an animal do to stay healthy?
Talk to their owner. So if you want a healthy pet, don't feed commercial food that you get at the grocery store or the superstore. For people who can afford it, if it looks like people food and it's balanced, which consultations can help you get good balanced diet for your pet. If it looks like people food and it is people food and it's the same quality of ingredients, that's your number one. Then if you live somewhere where the water is potentially contaminated, like you're dealing with, but see, I live in the country and I have well water. Worst we have is some iron, so that's not too bad. Minimal vaccines, so meet the law on rabies, depending on what state you live in, whether or not you need rabies vaccine. West Coast, not necessarily. East Coast, definitely. Once in a lifetime, at about 4 months of age, get that combination distemper parvo shot for dogs. It's called distemper for cats. No need for repeating of that. Minimal use of chemicals. There are some great, like you're talking about, supplements that help with overall health care. There's some nice whole food vitamins for pets. Several good companies out there on the internet. And great exercise and high quality, good air. So even for people who live in a city where smog and pollution is kind of a concern, then in the house, the HEPA filters and that sort of thing, so we have less going in. But that's your starting point right there, and all of that is really easy. The only thing that's expensive goes back to that very beginning, the pet food. But most people would rather pay money for the food than to come to see veterinarians or talk to people like myself.
Mm-hmm. Okay. Now, what about stress? How do you treat stress in animals?
That's the magic question for humans too, isn't it?
Yeah.
That goes back though to the inflammation. If you have good things going in, then there's less stress coming out. And so dogs and cats get adrenal fatigue just like humans do, but we stress them by what we put into and on the body. So good food, good exercise, good air, and good home life, that's going to take care of a lot of stress. And the rest, we can deal with it. There's some herbs to help. You were just talking the medical marijuana, and I think a lot of the public is used to the idea that medical marijuana treats pain because there's that aspect of the THC. But the research is talking about inflammation as well. And I think that's where it really has benefit in cancer, seizures. I consult with this woman is wonderful. She adopted 3 dogs with seizures because, she could do one, so she got 2 more. But medical marijuana for her pets has been huge in alleviating the seizures, and diet.
Another thing I take is, which is very helpful for inflammation, is it's a form of frankincense oil.
Frankincense, yeah.
It's frankincense oil. Boswellia is the same thing. And it's amazing, the Boswellia is not only good for inflammation, but it's also good for cancer.
Yes.
It's amazing. That helps me a lot with the inflammation. Between that, what about the supplements like turmeric? Do you give turmeric?
You bet.
Okay, now,
Absolutely.
how do you give it to them? In the pill form or capsule form?
I make it easy for the pet owner, however they can get it. Some people like to get it as the fresh turmeric root and grind it into that. I know you've heard of that golden, it's the golden oil, right, where you put it in with coconut oil and some black pepper and that sort of thing. And so some people will feed it that way. Some people get the capsules or the tablets of the curcumin, and whatever is easy for the pet owner, and then we figure out the dose down to the animal side. But here's the great thing. How much side effect are we going to get from too much turmeric?
Nothing. Health.
Exactly.
You're going to get health. I've been taking that for years. That is the main. I push turmeric. Like Dr. Sinatra says, I'm very bullish on turmeric. Because it does so many good things for your body, for your brain, for heart disease, for so many things. Now my new thing is the Boswellia. I do that quite a bit. And I rub the oil, that frankincense oil, on a pain or wherever I might, that's another miracle form of oil that's really good for people. So now let's get back to, now when you were in practice, you gave a medical exam. You say you wanted to do a full exam. What did that exam entail?
Okay, great question. My exams start when they walk in the door. I watch, so like if it's a dog, the dog walks in, how do they walk? Is it a smooth gait? Are they holding their head level? How's the body moving? What does the coat look like? What do the eyes look like? How are they breathing? And then, you see things like, is the dog really clingy with the owner, or do they come out and they greet me? Most of my patients, I would get down on the floor with them, and especially on the first visit, spend some time talking to the owner, and also give the dog some time to come over and see me. And in that time, then I'm feeling muscles, making things are nice and even on both sides. I'm feeling for pain, heat. You can feel like if they're sore in their shoulder, it'll be really warm. What does the coat feel like? Have you ever petted a dog or a cat and then afterwards your fingers were really greasy? That right there goes back to the inflammation, yeast in the body, that sort of thing. And then, we'd get on the table and I'd look in the mouth and I'd look in the ears and listen to the heart and feel all around. I'd check pulses. With the Chinese veterinary medicine training that I have, the pulse can tell a lot. If there's weakness, some kind of a deficiency in the body, or if we have some kind of an excess that suggests like either pain or maybe infection or inflammation.
For me, it's a very comprehensive exam. And what's interesting is that a whole lot of it is by sight, some by smell, a lot by feel, and a little bit of the exam uses the technical tools that we learned about in vet school with the stethoscope and taking temperatures and that sort of thing. But you can tell a lot about a dog or a cat simply by looking at how bright their eyes are and how good their coat is.
Now, do you also do blood tests and x-rays?
I used to do those, yes.
Okay.
Yeah, that was because I was an integrative veterinarian, I would take conventional medicine and then I'd put the holistic stuff in as well and come up with the least invasive procedure for the animal. And so there were absolutely times where we need blood work to know what's going on, absolutely need x-rays to know what's going on. When it's needed, you bet.
Okay, so now with the blood test, it could show you if they're deficient in different vitamins, right, that you took?
It can, and that's a great question. So what we learned at veterinary school is not the same as what we learn with all the alternative training, which I'm sure you've talked to human physicians about that. If I look at a blood panel and all the numbers are in the normal range, then conventional medicine says, they're fine. There's more information in that blood work, though. There's some biomarkers in there. And so if all of the liver numbers are maybe low, or perhaps some of them are high, like still in normal, but right at the end, then that's suggesting other issues. And absolutely, that's where we look at supplementation. You know, omega fatty acids are fantastic. Vitamin C, vitamin B. I mean, the list is so long. It's like, where do you start?
Right.
Lots of liver supplemented blood work. Yeah.
A lot of humans are deficient in vitamin D and iron and
Yes.
iodine, so many different things. That's why it's so important. This is why I take so many, at my age, I take so many different things to build up my immune system and to keep me healthy, you know, without any chemicals. So now, what about, how do you treat parasites or treat worms in animals? Because generally you would think there's a lot of worms and parasites in animals. Is that right?
Absolutely. Pretty much, you can always assume that a young puppy or a young kitten has worms, period. Normal part of the life cycle in either the queen or the bitch is that when the puppies or the kittens are born, there are worms encysted in the mammary glands in the breasts, and as soon as the milk comes out come these worm eggs. That's just a normal part of the life cycle. And so you assume puppies and kittens have worms, and they need to be dewormed somehow. There is the conventional way of deworming, which, you know, there are 4 or 5 different chemicals on the market that deworm. Some are more gentle than others. They're pretty quick. But what's interesting is that I've had some patients that have been dewormed with the conventional methods, but they still deal with parasites. And you can tell it not simply by the stool sample, because what we look for as veterinarians in that fecal sample are about 4 or 5 common worms. There are a whole bunch of, I guess I call them no-see-ums, because conventional medicine doesn't recognize them as causing problems, but they definitely cause inflammation. And the way you know it is when you go to the blood work, one of the white blood cells called the eosinophils will be high or high end of normal. And that suggests that there's either an allergic or a parasitic condition. And so that's, then I look in these patients for different options. There's some nice homeopathics that help take care of parasites. Stina is a very common CINA homeopathic remedy. There are some others. I have a client who She has 3 dogs that have never had any conventional treatment at all, period. Any. And so even the dewormer has been natural for these animals' lives, and it's great because it works. And so there's turpentine oil, there's wormwood, you can have anti-parasitic effects from neem. My brain is shutting off. Morinda. So there are many options out there. It's pretty neat.
Mm-hmm. Okay. Now, there are veterinarians that I spoke to that also do surgery. Did you do surgery when you?
I did do surgery.
Oh, okay.
I did. I did do routine spays and neuters. Ear hematomas, emergencies, foreign bodies, that sort of thing. But after surgery, then I would talk to the pet owner about detoxification, because we need to detoxify from the anesthetic. And in some cases, I had to use antibiotics or any other kind of conventional medication. And so then we talk about detoxification. So we go back to as healthy as we can, instead of do surgery, leave them with the consequences, and they go on for the rest of their lives. Try to go back to the beginning a little bit, yes.
Right. So when you did surgery, did you remove cancerous tumors?
Yes.
You did. Now, how did you do that? Can you explain a little bit? Because that's my next series of shows that I want to do, is to have surgeons come on and explain how they do it, because there's some alternative doctors, what they do, they encapsulate the tumor. So this way, there's no chance of it spreading.
Awesome. That's neat.
Right.
That's great. I'd love to know more about that, except I don't do surgery anymore.
Right.
But a lot of it depends on where the tumor is. Most tumors that people want removed are ones that they see on the outside that tend to be in the skin. A lot of those tumors in animals actually are fat deposits, which goes back to processed foods and that sort of diet. Every now and then I've had a couple of patients, and it was more before I learned holistic veterinary medicine. Like I would take out a lobe of the liver. If they had liver cancer, you can take out one piece of the liver and leave the rest. What I learned later was that we can just detoxify the liver and the body can deal with what's in there. So it's usually superficial skin tumors that I take out. And so, just say it's here on the arm. And if it's this big, then if it's this big, then you cut around it that big, take it out, send it to the lab, see what it is. When you know what it is, then what do we need to do to prevent it from coming back? And then I would go to herbal therapy, always talking about diet. How do we prevent things from coming back?
Right.
My experience is mostly superficial.
I'm glad to hear that you didn't say anything about biopsies.
No. Yeah, especially with the internal ones. Wow, don't they risk putting those tumor cells through the entire body?
A quick story. I went one time, a doctor said my PSA was high, and he had said I have to go for a needle biopsy. So I said, there's no way I'm going to go for a needle biopsy. I said, firstly, if there is cancer there, you telling me that it's going to bleed, you're going to put 11 needles in there to see where the tumor, if there's a tumor there. But you're going to put 11 needles and it's going to bleed. Right now it's encapsulated if it is a tumor. Why would you want to put needles in there and make it bleed and let the cells go all over the place?
Right.
So I'm against, my mother had colon cancer many, many years ago, and they wanted to do a biopsy. And I said, why would you want to do a biopsy? She can't even go to the bathroom because of a blockage. Just take it out, and then biopsy. Why would
Right.
you want to do it then? But anyway, that's my opinion on biopsies. Now, do dogs and cats in the blood tests get high cholesterol?
Not really. They don't process fats the same as humans. And why, there's a little caveat about that. So the typical cholesterol, how humans break it down in the VLDL and the LDL and the HDL, animals don't break their fats down the same way. The caveat being there's some animals that when you take the blood sample and you spin it down and you get the blood cells in the bottom and you're supposed to get this clear or straw colored serum at the top. I've had dogs where it looks like a milkshake because it's got that much fat floating in it, and it's in a different form than the HDL of a human. So that it's not a cholesterol the same as humans get. They can definitely have problems with fat and lipid metabolism. It's a different biochemical pathway.
Do they get clogged arteries?
They don't. Dogs and cats, not so much. Interestingly, cattle do. And I'm not sure what the difference is because you think cattle live longer, but they don't. Most of them get butchered by the time they're about 2 years of age. But in the older animals, you can see giant plaques in their arteries, and they'll even get this giant thing floating in the middle of the heart in cattle. So not the same.
Now, I think you said dogs get cancer more than cats. I think you said that. Is that right?
The statistics are showing that the cancer rate is higher in dogs than cats, yes.
Okay. Now,
But think about it. People take their dogs to the vet more often than they take their cats. Cats will stay inside. They won't go outside. They'll be exposed less to fleas. The pharmaceutical companies haven't convinced cat owners to give monthly heartworm prevention like they do in dogs. So there's a little less exposure in the cats than dogs. Also less breeding.
right. Now, you spoke before about detoxing. Now, to detox the liver, did you give coffee enemas at the time?
I have not. There are other veterinarians who do use coffee enemas. My way of detoxifying the liver was through diet and herbal supplements. Everybody knows milk thistle. It's one of the excellent detoxifiers for the liver. What I recommend in dogs is to feed a diet of white potato, sweet potato, and whitefish for a couple of weeks. And my seizure patients, that would be my recommendation to do that. Cleanse the liver and then add some milk thistle. And then there are other supplements like N-acetylcysteine, phosphatidylcholine. They're depending on the pathway of the liver that's challenged, how to detoxify it.
And also,
Lots of options.
Also turmeric, right?
Also turmeric, you
Turmeric.
bet.
It works on everything. It's amazing. That's why it keeps you healthy. Now, how did you treat heart disease? And how often did an animal get heart disease? And what are the symptoms? What are they to look for?
Okay, great. So you're looking for changes in exercise level, maybe coughing. And so they're usually elderly patients. And so some people say, well, my doggy's 10, he's just old, he's slowing down. But realistically, they're permanent children, so they should always be full of energy. So if a dog or a cat is slowing down, and heart disease is more common in dogs than cats, but if they're slowing down, it's worth listening to the heart. So commonly veterinarians will listen to the heart and listen for a heart murmur. What is not so common but easy to perform and inexpensive is you can check blood pressure. You can also check eyeball pressure because it's a surrogate for blood pressure, just like humans who get glaucoma. And then they can do ultrasound and that sort of thing. But so I go back to good nutrition, make sure there's no salt in the diet, and then let's take the dog that has high blood pressure. Blood pressure medications are designed to only take the blood pressure down about 10 points, because then the pharmaceutical companies get to do 2 and 3 and sell more medication and that sort of thing. Well, the great thing is that CoQ10 takes the blood pressure down 10 points. Hawthorn fruit takes the blood pressure down 10 points. We can do vitamin C and have an impact on blood pressure. And so it's tailoring the treatment to the patient, it's recheck, it's measure blood pressure, and how do we do it with as much safety and less side effects as possible. Blood pressure is easy. I've had patients that all it took was changing the diet, and we took care of the high blood pressure. It's beautiful.
Mm-hmm. Yeah, absolutely. Now, did you ever treat any animal with COPD? Do they get COPD?
They do. COPD, that name is reserved mostly for horses. They get allergic, heaves, and it turns into congestive pulmonary disease. And so it tends to be allergic. It tends to be related to hay in the barn. So often wintertime in some horses, but it can be summertime from the fresh grass. Now, dogs and cats do get pulmonary disease. It's not usually called COPD, probably because they don't go to a specialist who then puts that tag on it. But see, it's back to inflammation. It's allergies. That's the immune system out of balance. And so if you can get that immune system back into balance, take out the inflammation, put in the better foods and less chemicals, you can make a lot of that inflammation go away.
Right.
And then inhaling eucalyptus essential oil can help. Mm-hmm. You have to be careful. Your caveat is that animals are a lot more sensitive than humans to essential oils, and cats especially. Some cats just no essential oils at all, and pretty much the cat will tell you. If you open the bottle of essential oil and the cat leaves the room, no more.
Right.
But just the fumes can open the airways, and so you can nebulize or aerosolize with a diffuser the eucalyptus oil into the room for dogs with breathing difficulties. Yeah.
Also, that frankincense oil, supposedly, and boswellia, that's supposedly very good for asthma and for COPD, emphysema. And what a lot of doctors don't tell humans is that there are so many things you can do and find out that your body might need for COPD, such as glutathione. Glutathione
Right.
is one big, tremendous. How I know so much about this, because a family member has, and I've done my own research on how to help someone with COPD, and it's helping tremendously with the things that your body could be lacking, especially as you get older. Your body starts to lack these herbs like glutathione, which is very important. So unfortunately, unless you go to a naturopath, they're not going to tell you, try this and try that, and it might help you with asthma or emphysema. But anyway, now, what type of cancer do you see mostly in animals?
Mostly would be skin, usually fat in the skin. And so it's a benign cancer, but you worry about it when they get big. I have this one case that I consult with. He's a 12-year-old Labrador Retriever, very tall dog, and he gets fatty tumors. And he had one the size of a grapefruit in his armpit. And so it pushes the arm out of the way and makes him walk funny. And that's when you worry about it as a problem. Now, this same dog, he's a hoot. He's a really fun dog. He has a mass in his abdomen, probably bigger than a basketball at this point. But it's probably fatty. His appetite is good. His energy is good. It's slowly changing. He's not having any issues. It's been there for about 3 years, and it's not interfering with movement.
Mm-hmm.
Probably a fatty tumor. He's
Right.
good. He's fine.
Right. Okay. Now, I know you have a few books out there on Amazon. Can you
I
share
do.
them with your with our
Oh.
viewers?
Hey, I have one right next to me.
Okay.
Dinner Impossible.
Okay.
So this is a cookbook for dogs and cats for how to prepare balanced, healthy, nutritious meals. I have some recipes in there, like I talk about the liver detoxification diet in there. I have a whole section to talk about how to feed for health conditions, kidney disease, liver disease, different kind of crystals in the bladder, diabetes, all those sort of things are in there. And I do have some e-books on Amazon as well, healthy possibilities for young dogs, young cats, older cats. Some things to get people started thinking about so they can go, there are options. If my veterinarian doesn't know this, I need to go ask somebody else. And that's the whole thing, is to create the dialogue. And it's actually meant to build relationships, because there are a lot of veterinarians who don't know about all these alternative things, but they're open to it. And if somebody has a veterinarian who's open to it, that is just going to make it better for all animals in the long run.
Right. Now, you do coaching now in your retirement?
I do. I have
Okay.
lots of people who get a hold of me because they want to know how to improve their pet's diet, address a specific health disease, and to do it with food that's balanced and not going to create health issues down the road.
Okay, so your website is www.drcathyvet, is it .com or .org?
.com,
.com.
drcathyvet.com, and it's Cathy with a C.
Okay. Cathy with a C. Okay, is there anything that you want to talk about that we didn't cover?
You know, we covered really all the basic things that get people started thinking about long-term health in their pets. The one thing that I would say to pet owners is, if your dog or your cat is shedding, and they shed year-round, then that's your first sign right there of inflammation in the body. Shedding is not normal, even though we've been told that it is, but it's not. They should shed twice a year, spring and fall, and the rest of the year have a good coat. The more they shed, the more problems that are going on, and catch it early. Catch it before it turns to cancer. Go find yourself a veterinarian who says, oh, this is a greasy hair coat and you're shedding, this dog or cat has a yeast infection. Let's treat it early and avoid the cancer. So yeah, shedding is my number one sign, and there's a lot we can do to make that better for animals and hopefully give good longevity.
That is really good information, very good information. And I want to thank you for being on the Health Show.
My pleasure.
I think we gave our viewers a lot of good information today. So I thank you again.
Thank you.
And maybe we can do this again another time.
Sure, my pleasure.
Okay. So there you have it. Very, very informative. Pick up her, go to Amazon.com and pick up her book, and you will learn more about diet. You would learn a lot. She's got a few other little books out there also. If you want a copy of any of these shows, you can go on the Health Show, Boston.com, and get a copy. So I want to thank you for joining me on the Health Show, and we'll look forward to seeing you again the next time. Thank you.